Hello, class. The rare disease that I'm going to discuss is Rocky Mountain Spotted Fever. Rocky Mountain Spotted Fever is a tick-borne disease. Um, it is caused by ticks when you go out, little bugs, these little creatures right here, if you can see these little bugs right here. That's just one known species, the American dog tick. Um, but these little ticks, if you go out in bushes, wooded areas, anywhere like that, nature, where ticks will live, that's a common place for you to be bitten. So when a tick bites you, if it's an American dog tick, these are a few of the species: the American dog tick, the Rocky Mountain wood tick, and the brown dog tick. These ticks, they carry the bacterium Rickettsia rickettsii, and what happens is once they bite you or they attach to their host or animal, whatever it could be an animal, a human, whatever it attaches to, it instills this bacterium inside of your body, and it causes many problems. What this disease does is the symptoms that it causes is fever, vomiting, headache. You can develop abdominal pain. You also can develop a rash. Some patients may not develop a rash on at first, but shortly after a rash may or may not develop. The rash is the easiest way to diagnose this disease. Because if you have just the common symptoms like the fever or vomiting, the doctor can easily misdiagnose you, and that can be fatal. And treatment for this, once you're attacked, it has to be quick. So once you develop a rash, if you can see this, it's a small rash. It has little red bumps that may develop on your arms or legs or abdominal area, and they look like little spots. I guess that's why it gets its name, Rocky Mountain Spotted Fever. Makes a lot of sense. But the spots develop in certain places on your body, and so when the doctor notices this or diagnoses you with this, the first on-site thing to do is give you medication to treat it. And what is given is doxycycline. So remember that's the most common medication given is doxycycline for Rocky Mountain Spotted Fever. It cures it. It's the best. It's another antibiotic that may be given, but it's not the best because it has a lot of risk factors associated with it. But doxycycline is the number one, the most common treatment for treating this disease. Because after certain days, the disease becomes fatal, and the medicine needs to be administered within 5 days of infection, because that's the best way it will cure you from the disease. Also, there are some preventative measures that can be taken to avoid the disease or developing the disease, because ticks, they are known to be when it's warm outside during probably April and September. When you're outside, you should always use bug repellent of some sort to eliminate or keep from getting it. You also can you need to take a shower as soon as you're out in the wooded areas, and you need to check your body and your family's body for if they have been around or near any ticks. You have to do inspections, so a bath within 2 hours of being exposed, and also you should use some sort of bug repellent. That's a good way to eliminate it. And that is my rare disease, Rocky Mountain Spotted Fever.